Hi, my name is Jim and I was retired. Managing healthcare costs prior to Medicare is one of the highest priority for those of us that are forced into early retirement. The new law, the American Rescue Plan Act, has changed a lot of the way that we're going to think about that decision. Stay tuned to this video for big changes in COBRA and the ACA. I'll begin with my standard word of caution. I am not a professional. I have no special credentials after my name. So take this as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional, especially about healthcare choices after a job loss. When I was retired 5 years ago, my options were to continue the group healthcare coverage under my employer through COBRA, or to seek out an individual policy on the ACA. We opted for continuing COBRA coverage because our family was already on the one plan and the children had not yet found their full-time jobs with benefits after college. So for a year, we continued COBRA. That meant paying the full premium, my share plus the employer's share, and a 2% administration fee. The Kaiser Family Foundation says that the average cost for a family is $21,000 a year. And if you have met deductibles already and you're continuing care under your current group insurance, COBRA might be the expensive and right choice. But a lot of people opt for a less expensive choice under the individual coverage in the Affordable Care Act. Now, COBRA might be the less expensive option. That's because the American Rescue Plan Act provides for free COBRA coverage from April 1st through September 30th, 2021 for anyone who lost their coverage due to job loss or a reduction in hours. That's right, zero premium for up to 6 months. If you're currently on COBRA and it expires before September 30th, your COBRA coverage will end when your COBRA period ends. Typically, that's 18 months after separation of service. The new law also requires employers to notify anyone eligible for COBRA about this opportunity, and that includes people who may have declined it initially or let it lapse. Those folks will have 60 days after the new notice to rejoin COBRA. The coverage will only be prospective. It won't go back and retroactively provide coverage if they let it lapse. Anyone who previously declined COBRA and opted instead for an individual coverage under the Affordable Care Act may have to think twice before jumping back to COBRA, though. That's because the new law also provides dramatically increased premium subsidies retroactive to January 1st for everybody on the Affordable Care Act. Also, they've opened up a new enrollment period through May 15 to shop for the best deals with these new premium subsidies. Let's take a look at an overview from the Kaiser Family Foundation. As this article explains, the ACA provided premium subsidies for those that fell with income between 100 and 400% of the federal poverty level. But if you earned $1 more than 400%, you didn't get any premium subsidies. So this created a cliff for subsidies at 400% of the poverty level. If you earned $1 more, you lost all of your premium subsidies. As this example shows, a person who is 60 years old and earning $50,000 a year, or 392% of the poverty level, would get a premium subsidy, and they would pay no more than $410 a month for a silver plan under the ACA. However, if that same person earned $52,000 a year, or 408% of the poverty level, then her monthly cost would be $957 a month, and that is the average cost of the plan without any premium subsidy support. The American Rescue Plan Act now extends those premium supports to those above 400% of the poverty level for the first time, guaranteeing that nobody would pay more than 8.5% of their income for insurance. The new law also provides deep discounts for those from 100 to 150% of the poverty level, guaranteeing that their cost would be zero. And it also increases the support for those on unemployment insurance. So for those of us in forced early retirement, this 400% cliff is a big deal. We've been managing our income from retirement distributions, interest, and dividend to make sure that we stay below the 400%. Now, for this year and next year, we don't have to do that. Given these changes, whether you qualify for COBRA or not, you definitely want to take a look at the ACA premium support you might be able to get this year and next. Let's compare two examples using the Kaiser Family Foundation's website tools to see what kind of ACA support is currently available. Before the new law, a 60-year-old earning $55,000 for individual coverage would enter the information, and I'm using U.S. averages here instead of a more accurate state and zip code, but for this example, they would not be eligible for any financial help. And as this shows, they would pay $957 a month for silver coverage. However, under the American Rescue Plan Act, they now qualify for premium support, even though they're earning 431% of the poverty level. The premium would be $390 a month for coverage on a silver plan with the new premium subsidies. Now let's compare a family of four, a 60-year-old, a 56-year-old, a 18-year-old, and a 21-year-old, and see with a family income of $110,000 what they would get under the ACA. Before the new law, they would not have gotten any financial help, and the premium would have been $2,450 a month for coverage of a silver level. Now, because of the new law and the deeper premium subsidies, they are eligible for financial assistance even at 420% of the poverty level, and their monthly premium would fall to $779 a month. That's a dramatic savings. Now, let's imagine that both examples were eligible for COBRA due to a job loss last November 2020, and I'll use that date to ensure that their COBRA period extends through 2021. Let's also use the Kaiser Family Foundation's averages for individual and family coverage. For coverage for the family, as I said before, was $21,000 a year, and for an individual, $7,470. So accounting for the 6 months of free COBRA coverage in the examples of the family and the single person, that means that those costs would be cut in half for a COBRA coverage, and compare those to what they would get under the ACA. As you can see, the single person, 60-year-old, earning $55,000, would face a choice between paying $3,735 under COBRA, assuming she has already paid 3 months so far and will pay the final 3 months of this year, and then get the 6 months of COBRA for free. Or she could pay $4,675 under the new ACA rates with the premium subsidies. Clearly, COBRA is the better choice for her. But now let's look at the family. Their choice is between $10,500 for the COBRA coverage, that's half of the $21,000, or $9,350 for the ACA coverage for a full year. Again, ACA coverage would be the better choice. Now, if they're already on ACA, would it make sense to jump back for the free COBRA? Well, think twice before you do that. Once you're on COBRA for this year, you may need to stick with it, and that's because your next enrollment opportunity will be for 2022. I hope this thought experiment has been helpful. If you're facing the risks of an early forced retirement, please be sure to like and subscribe to this channel. And if you're currently facing the choice between COBRA and ACA with the new discounts, use the comment below to let us know how you're thinking about the issue. Thanks.